This is Chapter 33, Assessment of our Cardiovascular System. I think most of us know that it takes our heart, cardiovascular system, our respiratory system, and also our hematological system to provide blood, oxygen, and all of the resources that our major organs and other body parts need. The cardiovascular system is made up of your heart, all of your blood vessels, that's your arteries and your veins. And I've already said that it's responsible for supplying oxygen to the body organs and the other tissues and making sure that they're getting enough perfusion. Cardiovascular disease continues to be a really large cause of death in the United States. In fact, it is the leading cause of death for women and continues to increase. Your heart is a fist-sized muscular organ. It's located in between your lungs, and it pumps about 60 milliliters of blood a minute, which is a good amount. Your circulatory system delivers oxygen, nutrients, hormones, antibodies to all of your organs, tissues, and cells. It also helps to remove the end products, metabolism, all of those toxins and things that we don't need in our body from the tissues and cells. And that's it. Sorry. So this is a pretty complicated chart of the blood flow through the heart that I put on here. I think the same picture is in your book, but I put a little less complicated picture on the next slide. So for me, this makes a little more sense. You have your right and your left atria and your right and your left ventricle. Your heart is a two-sided pump. Your right side receives the deoxygenated blood from the body and pumps it to the lungs. And your left side receives oxygenated blood from the lungs and pumps it through the aorta to the body. The upper two chambers, what we call the atria or auricles, are your two receiving chambers. The right atria receives deoxygenated blood from your body through the superior and inferior vena cava, and it pumps it down into your right ventricle past your tricuspid valve. The left atria receives oxygenated blood from your lungs and pumps it into your left ventricle via your mitral valve, and then the deoxygenated blood is pumped through your pulmonary artery to your lungs, and then your oxygenated blood on the other side is pumped to your body from the aortic valve and aorta. The tricuspid valve, it guards the opening between the right atrium and ventricle. It prevents black flow, or what we call regurgitation. And then the mitral valve guards the opening between the left atria and ventricle and also prevents backflow. The tricuspid and mitral valve are called your atrioventricular valves. And then your semilunar valves are your pulmonary valve and your aortic valve. Your pulmonary valve is between your pulmonary artery and your right ventricle, and your aortic valve is between your aorta and left ventricle. Your coronary arteries, disease of these arteries is, of course, the leading cause of death in the United States. Your left coronary arteries supply your left ventricle, septum, and apex of the heart. Your right coronary arteries supply your right ventricle and the SA node. We'll talk more about the SA node in Chapter 34, but just know that the SA node is basically the pacemaker for the heart. And also realize that in the elderly and as we continue to age, those coronary arteries start to narrow. So that's when we start seeing, and that's called stenosis, and that's when we start seeing a lot more coronary artery disease. So we just basically discussed the specific valves. I forgot I had this slide in here, but patients that have like mitral valve prolapse, you will see are put on antibiotics generally prior to any major procedure, especially dental procedures, because they're more at risk for infectious type processes. And that's why it's really important to make sure your valves are working properly and the blood is not backflowing to where it came from. So murmurs and gallops. Murmurs and gallops can be normal for some patients. Your S2, which is your second heart sound, is caused by your aortic and pulmonic valves closing. Well, sometimes when those valves start to close, they can be delayed or can close early, and that's called a paradoxical splitting. It's an early closure of that pulmonic valve or a delay in the aortic valve closing. Your gallops and murmurs can be very common in heart disease. Your S3 is called a ventricular gallop, and then your S4 is referred to as an atrial gallop. And they can just be caused by those valves not, the ventricles not doing what they're supposed to be doing, not closing, not squeezing properly. May not be filling properly. The best way to hear an S3 or an S4 is with the bell of the stethoscope, and it's placed at the apex of the heart, and it can be heard during expiration. An S3 heart sound can be normal in a patient who is younger than 35, but it's abnormal if they're older than 35. It can be an early sign of heart failure or of a ventral septal defect, which means something's going on with that valve. The S4 atrial gallop can be present with patients with high blood pressure, with anemia, with ventricular hypertrophy, which means those ventricles are enlarged. Also with myocardial infarction. It can also be heard with stiffened ventricles. Murmurs reflect your turbulent blood flow through normal or abnormal valves. There's just a lot of blood flow going through there all the time. Murmurs are classified from grades 1 to 6, and you can look at those on table 33.3 and on page 640. And the one thing I didn't remember is just to remind you that your S1 heart sound is created by your mitral and your tricuspid valves closing. Your S1 is softer, it's longer, and it's a very low pitch. And it marks the beginning. Well, we won't go that route. A decrease in your S1 sound can occur in patients with heart failure. And if you're having trouble hearing your S1, then have your patient kind of lean forward a little bit, and that pushes the heart more towards the chest wall, or either roll to his or her left side. And we've already talked about the S2 being the closure of the aortic and the pulmonary valves. So your mean arterial pressure, or your MAP,